Arm lift surgery or brachioplasty is a relatively straightforward procedure if designed correctly, and you do not see any major complications with this procedure. However, there are some complications that patients need to be aware of, and the most common one is the fact that you will get a degree of bruising around the area of surgery, which can last up to about 2 to 3 weeks. There is also a small risk of collection of blood or fluid in the at the site of the surgery, what we can term as a haematoma or a siroma. And wound healing issues can sometimes complicate the recovery. Arm lift procedures do involve a bit of tension on the suture line, because you have to try and strike a balance between the amount of skin that is taken away and not putting too much tension on the stitch line. And this balance, if it is pushed onto the negative side of there being too much tension on the skin incision line, then there is a risk of wound breakdown, either partially or to along the length of the stitching that has been done. Patients do encounter a degree of altered sensations on the inner aspect of their arm. This in most cases is temporary, because the nerve in that area will be bruised or will be handled as part of the surgery, which can give rise to a degree of alteration of the sensation, which usually comes back to normal in about 3 to 4 months after surgery.